In late April 2010, 61 direct care nurses from Advocate Healthcare, participating in Advocates' annual Nurse Advocacy Day, motor coached their way to the state capitol in Springfield, Illinois, to meet with Illinois legislators. The nurses from across Illinois' largest healthcare system headed downstate to talk with lawmakers about issues impacting the nursing profession and healthcare as a whole. Jim Skogsberg, Advocate's president and CEO, set the tone for the day as he sent the group on its way.
You know, what you're doing is so important for this country, and I just want to say thank you. I know, I have every confidence you're going to represent our healthcare ministry in the finest fashion. But obviously, you got some business to do, and nobody can do it better than the nurse. Probably the most trusted voice in healthcare today. Thank you for what you're doing. Not just for Advocate Healthcare every day, for what you're doing for our patients, but for today, for going down and making the healthcare system a little bit better.
This is the fifth year that we've gone down to Springfield to meet with our legislators. I look forward to this day. I'd say it's one of my favorite days with the Nurse Advocacy Council. Originally, we started with just a small bus. This year, we're bringing 2 buses of Advocate nurses down, and that is just so exciting that this program continues to grow.
The group that made the trip to Springfield was comprised of members of Advocates Nurse Advocacy Council and their invited guests. The council is a unique program that provides Advocates' 9,000 nurses, the largest nursing audience in the state, with an opportunity to engage in the legislative process, giving them a strong voice on important healthcare issues. The group was welcomed to Springfield by the state Senate and House as they took a brief tour of the Capitol building. Nurses met individually with 47 state senators and representatives to discuss issues that impact their profession and their ability to deliver quality health care. The nurses spent time outlining their views on critical initiatives such as continued support of the nurse staffing by acuity law and opposition to pending legislation that would mandate nurse staffing ratios, ignoring nursing experience, the shortage of nurses across the nation, and dynamic patient needs. The trip concluded with a brief meet and greet with Illinois Governor Pat Quinn, where the nurses took advantage of some time with the state's top executive. The positive impact of Advocates Nurse Advocacy Day follows the nurses from Springfield back to their sites of care.
Great. I feel empowered that I was able to go down there with a group of nurses that really care about the future of not only ourselves but of our hospitals, our advocate system. The best thing to come out of it is that we were able to speak not only for nurses, but we always are doing what's best for our patients.
The Advocate nurses are looking forward to next year's Springfield trip, as well as to hosting their annual legislative forums each fall for lawmakers and their staffs. These opportunities allow Advocate nurses to be heard directly by those making critical healthcare decisions.